All right, Steve Darling back here with Proactive Vancouver, and joining me on the line now is Dr. Nadir Pourhassan, the CEO of CytoDyn. And Nadir, great to see you again.
Thank you for having us.
And also Dr. Bruce Patterson, the CEO of Incel DX. And Dr. Patterson, nice to see you as well.
Likewise. Thank you, Steve.
So we're here to talk about the next stage in testing that you've been able to do with your lead drug, and I want to talk with Dr. Patterson first because the results were very impressive. Tell me a little bit about the study and some of these patients that were extremely ill. Is that right?
Yeah, the important part of this study is that the 10 patients that were enrolled were extremely ill. Many of them had renal failure. All of them had been either on a course of chloroquine or hydroxychloroquine at the time at day 0. And that was at a time when these patients had severe immunodeficiency due to a significant decrease of what's called CD8 T cells, which are basically the effector cells which clear virally infected cells. And those are at 5% instead of the normal 30% of T lymphocytes. So, you know, the profound immunologic abnormalities at the beginning were striking.
And then, of course, you go into the testing part of it, and these ill patients. Explain to us how this drug has affected them and what it's able to sort of work on this cytokine storm that we've been talking about.
Yeah, we're seeing actually two great effects and positive effects of Leronlimab. Number one, it's restoring the immune cells to their normal levels or close to normal levels at day 3, and some of the day 7 results show that the CD8 cells are back to their normal range. In addition, we're quieting the cytokine storm. We're seeing decreases in cytokines, especially IL-6. That's related to responsiveness, and they're going down as much as 70 to 90%. And I think that's significant on 2 levels. Number one, we're reducing the cytokines that cause the lung damage, but we're also restoring the immune cell populations and relationships that are there to fight off other infections, because many of these patients are dying of other infections. That's why I'm not surprised that azithromycin, a very broad spectrum antibiotic, is helping. It's not reversing the effects of the cytokine storm on the lung damage, but it's helping these patients from dying of bacterial infections that they otherwise wouldn't have.
Now, Dr. Pourhassan, to you, we've obviously seen the successes that you've had so far in the very serious cases. This now takes you to the less serious cases. Is that the next step?
I want to make sure everybody understands that the 8 patients that the results that we talk about was 8 out of 10, because the last 2 patients, we don't have their 3-day results. This is the results from the beginning and the results at the 3-day. All 8 patients had immunological benefit, according to Dr. Bruce Patterson. And these patients are in a very bad situation, according to Dr. Patterson, and the doctor who injected them indicating. Now, the same kind of test that was done, the same kind of study with this type of patient in China, just to give everybody a perspective, 31 out of 32 in that study died. So these are the people that have a very, very difficult time staying alive. We have a patient right now that's being discharged. We have a couple of patients that we said got out of the ICU, and the results will keep coming out. We're turning that results today to the FDA. And then the other 2 patients, when we get their 3-day results, Dr. Patterson will provide that for the FDA. So with the path going forward, now the study with our mild and moderate patients will start. That's the big one, because if we can give it to patients who are hospitalized but they have mild or moderate, we believe the results are just going to be fantastic. This is what we hope for. We don't have any data to talk about it, but if that's the case, we believe we can help the patients who are desperate right now and the patients who could be desperate but they're not desperate yet.
So you're dealing with obviously the hospitals. So when is this expected to start?
Well, we have so many hospitals from Harvard, Massachusetts General Hospital, Cornell, UCLA, San Francisco. Everybody wants to enroll now because they see the scientists are not shareholders. They look at the science, and Dr. Patterson deals with them, and they are convinced that this is really, really strong. Dr. Jay Lalezari, as Chief Medical Officer, is trying to enroll. So the study on both trials, phase 2 trial for mild and moderate, and the phase 2B-3 for severe, should start either today or tomorrow. I mean, the injection of the first patient, go ahead.
Yeah, Dr. Patterson, you're obviously in science, so you look at the science and look at the data of the things, but do you feel that so what you've seen so far, that you feel hopeful moving forward with this?
Well, absolutely. I mean, you know, the thing is, we didn't know what these patients looked like, either virologically or immunologically, before we started studying them. And, you know, we saw some of the data coming out of China, which was very preliminary, but we're seeing for our own selves what state these patients are in when they presented to us. And the fact is, you know, these patients have severe immunodeficiency on top of the cytokine storm causing the lung damage, and on top of multi-organ system failures. And so, you know, we're very pleased with the results of saving some of these patients, because these patients they had one direction to go. And, you know, that's where we're intervening. And that's very satisfying on a number of levels. And as Nader pointed out, you know, when we can intervene earlier, we feel like we can have even more impact in preventing these patients from getting to that point. And, you know, this disease progresses rapidly. A lot of the studies coming out have shown that they go from mild to moderate disease to severe disease very, very quickly. So that's the time to intervene. And I think the first study on the mild to moderate cases will have a tremendous benefit, because we'll see exactly what we can do under less onerous circumstances.
So, Dr. Pourhassan, last question to you, and that is path to approval now is it takes the study first, then get reported back from the FDA. Sort of give us an idea of what happens next.
So we need to make sure that we have quite a bit of manufacturing in process. So we're working with both of our manufacturing, and as soon as we have some interim analysis or the final analysis of these two trials, which we hope to enroll within 2 to 3 weeks. There's a lot of people want to enroll in these trials. As soon as we get those, we're going to get in front of the FDA and present them with the data. FDA needs data, and that's the most crucial thing, and we're focused to get those.
Dr. Bruce Patterson, Dr. Nader Pourhassan, gentlemen, thank you so much. Continued good work ahead. You're doing important work, and we sure appreciate it. Great to talk to you. Thank you very much.
Thank you
Be
for
safe,
having me.
everybody.